Hello guys, welcome back to Wimarb Nutrition, and as always remember that we are the products of what we eat, so you have to watch whatever you eat. And in today's video we are going to learn about heartburn. So we are going to define what it is. We are also going to look at some of its symptoms, the causes, and also the risk factors to this heartburn. So make sure to watch this video till the end. And before we get into the video, kindly hit that subscribe button and turn on the notification bell if you haven't. Let's start by defining what heartburn is. So heartburn is that burning feeling in the chest that is caused by acid reflux. So this happens when the stomach acids flows back to the throat or towards your esophagus. Experiencing a heartburn occasionally is normal, but if it occurs or if you experience it persistently, then and also it gives you discomfort, you have to seek medical attention. Also, the symptoms of heartburn are more similar to the some of the symptoms of heart attack, so you have to be keen, not to ignore thinking that it's a heartburn, and yet it could be an heart attack. So you have to really be keen. So these are some of the symptoms of this heartburn. Number one is that you will always feel the burning pain in the chest that could arise maybe after eating or at night. You also would experience pain that always or that would worsen when you are lying down or you are bending over. You can also experience difficulty in swallowing, a bitter or acidic taste in the mouth, or even a carving and hoarseness. So on the causes, we have one major cause. So, and this is if the lower esophageal sphincter isn't working well. So let's try to understand what happens. So once we eat, that's after you've ingested food and the food is chewed, the food is swallowed. Then the food then passes through the esophagus to get to the stomach, the lower esophageal sphincter, which have to relax to allow food and liquid to flow down into the stomach. So once this food and liquid passes, it tightens up. This acts like a barrier. It only allows food to flow from the esophagus to the stomach and not flowing back from the stomach to the esophagus. So when there is a problem in this band of muscles, then acid from the stomach can flow back into the esophagus and thus causing the pain. Let's look at the risk factors for this heartburn. The risk factor number one is being overweight and or obese. So we have abdominal obesity increases the intra-abdominal pressure due to the transmission of gravitational force of the adipose tissue to the abdominal cavity. So we won't look much into the science of it, but with this, if you are having this obesity or the abdominal obesity, it would affect the functioning of the lower esophageal sphincter, and this means you would occasionally experience these heartburns. The second risk factor is pregnancy. So heartburns are common during pregnancy, especially during the third trimester. So we are going to look at what you can do so that if you are pregnant, you don't occasionally experience these heartburns. Number three risk factor is taking certain medications. So when taking drugs like ibuprofen, sedatives, and aspirin, you can occasionally experience heartburn because they increase the risk of experiencing them. Number four is when you have a condition known as hiatal hernia. So this is a condition whereby the upper part of the stomach penetrates through the diaphragm. So it could be through a way of weakness or tear. So this would mean the functioning of the lower esophageal sphincter is compromised. Number five risk factor is Smoking. So we have nicotine can weaken and relax your esophageal sphincter, allowing for backward flow of the stomach acid, which thus causes the heartburn.